Hello, welcome everyone. Last session we have discussed about the polymers in the novel drug delivery system. So the next topic in the novel drug delivery system is muco-adhesive drug delivery system. So why are these systems significant and why are they important in the novel drug delivery system? So first of all, let us see the name, muco-adhesive drug delivery system. So as the name is clear, it is stating that there are dosage forms. These are the dosage forms which will attach to the mucous membrane. So these are the dosage forms which will attach to the mucous membrane. Just give me a minute such that I can have this pen. So what are these muco-adhesive drug delivery systems? So these are the dosage forms which will attach to the skin or mucous membrane. Why this mucous membrane attachment is so essential? There are certain drug dosage forms which have less bioavailability. So we know what is meant by bioavailability. So bioavailability is the extent of drug that reaches the systemic circulation. But unfortunately, there are certain drugs they do not have sufficient bioavailability, or they may undergo extensive first pass metabolism. In such cases, there should be an alternative route. So one such alternative route is this muco-adhesive dosage form. So as the name is suggesting, the tablet or the gel, it will attach to the mucous membrane. So since it is attached to the mucous membrane, it will release the drug for a prolonged period of time without having any adverse effects. So let us see the definition. So these will interact with the mucous layer. These dosage forms will have certain interaction. It may be an electrostatic interaction, an adsorption, or a van der Waals binding. There is some sort of interaction by which it will be releasing more amount of drug. There is increased resistance time. So due to the increased resistance time, the drug is going to stay for a longer period in a given site, by which its absorption will be increased. So that's the main point of devising this muco-adhesive drug delivery system. So muco-adhesive drug delivery system is a part of controlled drug delivery system. So since they are releasing the drug for a prolonged period of time, so they can also be used as a controlled drug delivery. Hence they become a sector under the controlled drug delivery systems. So and where are the footpaths in the history? So this muco-adhesive drug delivery system started way back in the year 1980. So from there onwards, there are number of ramifications, there are number of developments in this muco-adhesive drug delivery system. So these, when combined with other capabilities like enzyme selection, or when they are combined with tagged molecules like antigens or antibodies, they can be directed and they can be used for targeted drug delivery. We can use them for active targeting of drug delivery to a certain tissue, and we can prevent the adverse effects. So muco-adhesive drug delivery systems are developed not only for the oral, they are developed for buccal cavity, for nasal cavity, for rectal cavity. So these special dosage forms will be giving a local relief, not only therapeutic action, they can provide a local relief. Suppose imagine there is a case scenario where there are hemorrhoids or where there are oral ulcers. I don't want the drug to be released all throughout the body. So we can use this muco-adhesive drug delivery systems to release the drug only at the site of affected area, but not in the other areas. So those drugs which are needed to be incorporated into the muco-adhesive drug delivery system should be hydrophilic, preferably hydrophilic, or they should be having lesser molecular weight. But even peptides can also be given by this muco-adhesive drug delivery system by altering the polymers. So in the name muco-adhesive, let us split into two parts, muco and adhesive. So it is consisting of two parts. So what is this muco mean? So mucus is the inner layers called as mucosa. Under the skin there are a number of layers of mucosa. So your drugs are targeted at any of these areas. So your drug should be soluble in any of these mucosal layers. The chemical character or the physicochemical characteristics of these drugs should match with these layers. And what is adhesive? So they have certain amount of adhesion, certain amount of cohesion with your mucous membranes, by which it will stay for prolonged period on the mucous membrane. Hence the name muco-adhesive drug delivery systems. So what is the composition of mucus? As the name is suggesting, muco-adhesive drug delivery system, the chief component is mucus. So let us see the composition of mucus such that we can have an idea. See, if you see the composition, water is accumulating for a amount of 95%. It is comprising to an amount of 95%. So that means your drug to be incorporated into the mucoadhesive drug delivery system should be definitely a hydrophilic drug, otherwise it is not going to get released or dissoluted in this mucus. So that's the first characteristic. Next is it also contains lipids to an extent of 0.5 to 5%. So if it is a lipophilic drug, its log P value should be closer to 5 but not exactly 5. So those drugs which are having a log P value of 2 to 3 will exactly be dissoluted in this mucous membrane. Apart from this, we have minor amounts of mineral salts and free proteins. So that's the composition of mucus. It's a viscoelastic fluid, as the name is suggesting. Its viscosity is very high and it has this elastic property. It can extend to accommodate the drug. So you can see this is the structure of the skin. So if we develop a transdermal patch or mucoadhesive patch, it will be attached to the skin in order to reach into this capillary. So this is a blood vessel into which it will access the heart. So in order to get access to the heart, your drug has to bypass all these layers. So it is very essential for a pharmacist to know what are the layers under the skin. So there is a keratinized layer which is made up of dead skin cells. So your drug should not damage the integrity of this keratinized layer, otherwise it can cause local sensitization or irritation on the skin. So this is the first point to be remembered. It should not cause sensitization or irritation to the skin to be successful. After which we have a stratified squamous epithelium. So your drug should have lesser molecular weight such that it can pass through these small passages which is present between the cells. After which we have the various layers like lamina propria, submucous layers. Your drug should not cause any irritation in between these layers. So whatever its pH is there, it should be isotonic with that of these layers, otherwise it may cause irritation. So in between we have these glands, sebaceous glands or sweat glands, and there are also nerve openings. So your drug should not cause any sensitization or damage to these nerve endings, otherwise it may cause anesthesia or it may cause the numbness into this nerve ending. So make sure your drug is not interfering with the other functions of the skin but releases the drug directly into these capillaries, either veins or arteries. So next is, what is the function of this mucous membrane? So mucous membranes are part of our body to have protective function. So it will protect external stimulus. It will be serving as a barrier such that external agents will not enter directly into the tissues, and it will provide an adhesion such that the loose connective tissues will be binded together as one unit, and they provide lubrication. There are two secretions, sweat and sebum, especially on the skin. These things will have thermoregulation, temperature control, as well as it will help the skin to be moist and not get dry during different activities of daily living. So what is the need for mucoadhesive drug delivery system? So it can prevent the first pass metabolism. So what is first pass metabolism? If a tablet is taken by oral route, it will travel through the stomach, duodenum, the small intestine, large intestine. So from the largest intestine it will be excreted out. So here our body is devising its circulation in a way that all the capillaries from the small intestine will be reaching to the liver through hepatic portal vein. Unfortunately, there are some drugs which undergo metabolism during this first pass itself, and this phenomena is called as first pass metabolism. So in order to avoid the first pass metabolism, I can devise a drug which will attach only to the stomach. It will not move to the other areas, so which will ensure that the drug released or dissoluted will be present only in this local area, but it will not be spreading to the other area. So we can prevent the first pass metabolism by devising a mucoadhesive drug delivery system. So we can also improve better absorption by improving the gastric residence time. So whatever your drug, due to its retention, due to its adhesion, it will retain for long period of time. So due to the highest gastric retention, mentioned, it may cause higher better absorption, and we have this prolonged resistance time, and there is also localization of the drug. Whatever your drug concentration, it will stay only in this local area but will not spread to the other areas. This is especially helpful if the patient is suffering with gastroesophageal reflux disorder or gastric ulcer, or if there is a H. pylori infection. So in these areas they are going to be better beneficial to the patient. So what is the mechanism involved in this mucoadhesive drug delivery? So we have several theories which we are going to see very shortly. So here he'll give you a brief idea. So there are two steps in contact of this mucoadhesive drug delivery system. First step is contact stage. So in the contact stage, your drug will first interact with the mucous membrane. Suppose this is your drug molecule and this is our mucous membrane or skin. So it is first going to get contacted. So this contact stage can be due to electrostatic interactions or due to other interactions such as van der Waals interactions or hydrogen bonding, etc. So both of them will first introduce to each other. So that is contact stage, after which they will deeply interconnected with each other, which is called as consolidation stage. So there are two steps in the interaction. One is the contact stage, next is consolidation stage. So the success of a mucoadhesive drug delivery depends on this consolidation stage. Higher the consolidation, higher will be the interaction between the drug and skin. So step 1. So whatever we have learnt in theory, let us see through some illustration. So this is my drug molecule. So we are using hydrocolloids. We will choose a polymer which is belonging to a category of hydrocolloids. So hydrocolloids will absorb water. As soon as they absorb water, the shape or size of this molecule will increase. So previously this molecule was this area, now the area was increased by almost 2 times. So due to this swelling, the lipophilic or hydrophilic chains over here will get exposed to the area. So now the exposed films, lipophilic films which got swelled, will interact with this mucin proteins or lipopolysaccharides which are present in the mucin or mucous membrane. They also have the fibers. These fibers and our hydrocolloid fibers will get tightly entangled with each other. So due to this entanglement, they are going to bind for a longer period of time. So this is interpenetration of mucoadhesive and mucous polymer chains. So step 3. So there are 2 points here. One is this contact stage, the other one is the consolidation stage. Once the entanglement is done, your polymer molecule will be tightly bonded to this mucous membrane. Once it is bonded, your drug molecule will be slowly released into the systemic circulation. So you will have a slow and a controlled drug release into the systemic circulation. So due for this contact, so we have seen that there is a contact stage and there is a consolidation stage. So how this contact and consolidation is occurring? It can occur by any of the following theories. First one is electronic theory, wetting theory, adsorption, diffusion and fracture theory. Each of one is having an explanation. So let us go through one by one. First one is electronic theory. So as we can see, the structure of mucus is negatively charged. So we can have a glycoprotein molecule and this glycoprotein mucin network and the bioadhesive material. Since the mucus is negatively charged, it is having this disulfide bridges. If you are preparing a polymer whose charge is positive, due to this opposite charge, both of them will have an interaction which will result in mucoadhesion. So that's theory number 1. Theory number 2 is wetting theory. There are certain compounds which when exposed to water, they will swell, and due to this swelling there is entanglement or interpenetration between the molecules. The next one is adsorption. There are certain compounds which have surface forces which may be covalent bond or ionic bond or hydrogen bonding. So these bonds will adsorb onto the surface of mucous membrane, and it can be the factor for attachment between the drug and mucous membrane. So what is diffusion theory? Diffusion theory is movement of solute molecules from high concentration to low concentration. So since these polymeric molecules are hydrocolloids, their molecule exposure is very high, and here the molecule exposure is very low. So both of them will get attached with each other once there is an interaction between the two. Next is fracture theory. So fracture theory is there is the molecule which when exposed, there is formation of new crack length. So this crack length will exactly bind with my mucous membrane. It is exactly matching with my mucous membrane. So what are the different routes of using this mucoadhesive drug delivery system? So we can use them as a rectal drug delivery systems or vaginal drug delivery system, ocular. So we can use any mucous membrane of the body. So we can see here rectum, ocular cavity or nasal cavity, buccal cavity, sublingual cavity. So everything can be used for the mucoadhesive drug delivery system. So penetration enhancer. So here comes one problem. Suppose you have your drug molecule and we have the mucous membrane. So not every drug molecule is having sufficient HLB value to cross through the skin. So hence we will add one extra agent. So this agent will promote the penetration of the drug into the skin. So that extra agent is called as penetration enhancer. It will promote the penetration of drug into the skin. So substances such as benzalkonium chloride, dextran sulfate and some fatty acids or DMSO, dimethyl sulfoxide or DMF, dimethyl formamide, can be used as a penetration enhancers to enhance or penetrate more drug into your skin. So what are mucoadhesive polymers? So mucoadhesive polymers are the ones which will help in the interaction between drug and the mucous membrane. So most of them, they can be classified based on whether they are natural source or they are obtained from artificial source. So this one are the natural and semi-synthetic polymers, agarose, chitosan, gelatin, pectin, CMC, etc. So these are completely synthetic, they are synthesized in the laboratory, polyvinyl alcohol, polyvinyl pyrrolidone, methacrylic acid, etc. So according to water solubility, so the one we have seen previously, it is depending on the source. The one we are seeing right now is depending on the water solubility. So some they are soluble in water. Suppose your drug is water insoluble, your drug is not soluble in water. We can use a water soluble polymer to make a good balance between HLB. So polymer and drug will strike a good balance such that it will be released more into the body cavity. So there are also water insoluble polymers like carbopol, polyacrylic acid and PEG, polyethylene glycol, and basing on the charge, whether they carry a positive charge or negative charge, they can also be classified in the given manner. So what are the various factors which are affecting this mucoadhesive polymers? So the molecular weight, higher the molecular weight, lesser will be the drug absorption. Concentration of polymer, higher the concentration, higher will be the mucoadhesion. Flexibility of polymer, higher the flexibility, higher will be the attachment. Spatial conformation and cross-linking, usually when these parameters are high, the drug absorption will also be high. So environment related factors, so pH, so your drug pH should exactly match with the polymer pH. If both of them are not matching, it may result in drug degradation. And how much amount of strength, mucoadhesive strength is present, higher the strength, higher will be the mucoadhesion. So mucin turnover, so this is a physiological factor, so higher the mucin turnover, higher will be the drug interaction with the body. And any disease states like asthma or chronic obstructive pulmonary disorder, it may affect the amount of drug released into the tissue. So what kind of dosage forms can we prepare by using this mucoadhesive drug delivery system? So we can prepare semi-solid dosage forms, solid dosage forms, or mucoadhesive dosage forms, or even we can use a liquid dosage form like suspension, in situ gels or in situ liquids. So we can prepare these matrix tablets by using a mucoadhesive polymer, which will give more control to the drug delivery in the targeted tissues. So this is a discussion about various dosage forms, how they can be prepared. Say for example, in preparation of films, we will prepare a flexible elastic film by using a sufficient hydrocolloid, and in preparation of gels or ointments, we are using this sodium carboxymethyl cellulose or xanthan, etc., to achieve that sufficient mucoadhesive characteristics. So once we prepare these mucoadhesive drug delivery systems, how can you evaluate the parameters, whether it's a good one or a bad one? So we have to evaluate its characteristics by determining the tensile strength. Usually higher the tensile strength, higher will be the mucoadhesive nature. Next, you should determine the shear stress. So higher the shear stress, higher will be the mucoadhesiveness. Next, adhesion weight method, how much weight it can carry. Usually it should be higher. in order to get passed in the quality control test. So fluorescent probe method. So this one will give you how many hydrophilic polymers are present and how many hydrophobic polymers are present in a given dosage form, and such that we can easily qualify or we can evaluate the parameters of the dosage form. So all these things, electrical conductance, swelling properties, should be measured to see the given dosage form is successful or not successful. So even in vivo methods within the body also it can be tested to see the quality of the dosage form. So with that we finished up this mucoadhesive dosage form. So to conclude, we can say that mucoadhesive dosage forms are helpful to avoid the first pass metabolism and to increase the absorption of drugs from the body, right? Thank you.